Good morning, Jacksonville. Thanks for tuning in today. My name is Daniel Miller, and this is Ms. Harris, and we will be your hosts for this show.
As summer draws closer, more and more people will be taking vacations to lakes, rivers, and cool down. However, as the sun shines down and starts to warm the water, there are more than just sunburn that you should just be watching for.
Very true. Warm water is a place where many microorganisms thrive, and a terrifying one that needs to be watched out for is the brain-eating amoeba.
I know that most people considering contracting brain-eating amoeba is a rare occasion, but since the mortality rate is 99% death, I think we should raise awareness.
I agree. Here today to tell us a little bit more about the amoeba is Dr. Kristen Palmrose, a microbiologist from the Centers of Disease Control and Prevention.
Hello, Dr. Palmrose. How are you doing today?
I'm doing very well, thank you.
So, Dr. Palmrose, could you please tell us a little bit more about the brain-eating amoeba?
I would be glad to. The scientific name for this organism is Naegleria Fowleri. It is a thermophilic parasite protist. Out of 30 species, only Naegleria Fowleri can cause disease in humans. This organism has 3 morphological stages depending on its environment. It can be in its trophozoite, flagellate, or cyst stage.
So in which stage is the amoeba dangerous to humans?
The amoeba is dangerous when it is in its trophozoite stage. It possesses this stage when in a warm body of water or when in the human body. It will enter its harmless cyst stage when the temperature conditions become unfavorable, and its flagellate stage when its pH is altered, such as when it is introduced to distilled water.
You know what we haven't talked about yet? How does it enter the brain?
It enters the brain when unsterilized warm fresh water goes up the nose, through the nasal cavity and into the brain. So jumping into water, using a neti pot, or swimming when sediments are stirred up is highly unadvisable.
So what exactly happens when the amoeba enters the brain?
Well, first off, the brain is the perfect environment for the amoeba to reproduce and feed. It has everything necessary for the protist to thrive, such as moisture, shelter, a warm environment, and a food source. So as soon as the parasite enters the brain, it begins to attack the cells. It extends its pseudopodia into the cells, and when it breaks through, it ruptures and it begins to feed. So as the amoeba feeds on the brain cells and destroys the tissue, the brain will swell and eventually it leads to death.
Why is the body's immune system unable to fight off the parasite?
When the body's immune system attacks this organism, the organism has a protective coat around it that the white blood cells attach to. Once the cells are attached, the amoeba will shed this coat and escape unharmed.
Well, Dr. Palmrose, thank you for sharing this information with us. You were very informative, and we now have a good understanding of how this parasite operates.
Our next guest is also from the Center of Disease Control and Prevention. Her name is Miss Hannah Skipper, and she's a public health educator and/or advisor.
She will be sharing with us how common an occurrence of the disease is, signs and symptoms, prevention methods, and some other important information.
Hello, Miss Skipper. Would you please tell us what the disease the amoeba actually causes?
The actual name of the disease is primary amoebic meningoencephalitis, which is often compared to, but should not be confused with meningitis.
So, how often does a case of PAM occur?
It is actually a pretty rare event. From 2002 to 2011, only 32 infections were reported in the U.S. What makes the disease so troubling is the fatality rate, which is over 99%. From 1962 to 2011, only 1 person of 123 infected individuals has survived in the U.S.
What are some common signs and symptoms of the disease?
In the early stage of the disease, some common symptoms are severe frontal headache, fever, nausea, and vomiting. As the disease progresses, a stiff neck, seizures, hallucinations, and a comatose state is often common.
When do these signs and symptoms start appearing?
The incubation period from when you contract the disease to when the signs start to appear varies from 2 days to 2 weeks.
How do doctors actually diagnose this disease?
PAM can be diagnosed from lab reports detecting Naegleria Fowleri organisms in cerebrospinal fluid, biopsy or tissue specimens. It can also be detected through the species nucleic acids.
I know that we've discussed how the mortality rate is extremely high, but are there any treatments for this disease?
Well, although most cases are fatal, 2 well-documented cases of survival have been compared. It is believed that the strains of the parasite that the patients contracted were less infectious, but it was noted that some of the medications were the same. These medications were amphotericin B, rifampin, and dexamethasone. Treatments nowadays often center on giving patients these same medications.
So, since there aren't any effective treatments, are there any helpful methods of prevention?
Best methods of prevention are to simply hold your nose shut, use no clips, or hold your head above the water while swimming. You should also try to avoid stirring up the sediment while swimming. If you are making a solution for irrigating, flushing, or rinsing your sinuses, use water that has been previously boiled for 1 to 3 minutes and left to cool, water that is filtered, or purchase water with a label specifying that it is distilled or sanitized.
So exactly what type of waters should our viewers try to avoid?
They should want to avoid warm lakes, rivers, ponds, and any other untreated polluted waters. In my professional advice, I recommend you take as many precautions as possible to potentially save you and your loved one's life.
Before we end this show, we would like to share the story of Kyle Lewis with you. In August 2010, 7-year-old Kyle passed away after he contracted the parasite. The young, adventurous boy from Connecticut only survived 3 days after symptoms appeared.
In his honor, a foundation called Kyle Cares was created to raise awareness about the horrifying amoeba that took this young boy's life, along with many other loved ones.
If you would like to send a donation to this foundation to raise further awareness and help doctors and researchers find a faster way to diagnose and possibly find a way to cure PAM, please visit the website at kylecares.com.
It appears we're almost out of time for today. Thank you so much for coming on the show and talking with us.
And thanks to all our viewers at home who tuned in today. Remember to be careful when you're going in water.